We were warned the elderly in our society would be amongst the most vulnerable to the spread of coronavirus. Even so, we can now reveal allegations the high number of deaths in care homes may have been exacerbated by the government's own policies over the transfer of COVID patients from hospitals. Sky News has spoken to dozens of care homes about the guidelines. Fearful of repercussions, none would appear on camera. In a statement voiced by an actor, this is what one owner said to us.
My anguish and sadness is purely arisen from the thoughtless and neglectful conduct of the local authorities, demanding that providers admit into their homes COVID-positive and untested residents. This has undoubtedly caused a huge spike in the infections and resulting in deaths that were avoidable.
Thousands of deaths have now been recorded in UK care homes. With the help of Care North East and the Registered Nursing Homes Association, we contacted a large cross-section of care homes in Britain. More than 90 responded to us. We asked, did you feel pressure from hospitals to take patients? 70% told us they did. We asked, did hospitals discharge patients to your care home with COVID-19 symptoms before April the 15th? 41% said yes. And we asked, do you think COVID-19 positive patients discharged from hospital caused the virus to spread in your care home? 38% said yes, they did. At the start of the outbreak, I revealed concerns about the impact the policy would have. This was the original advice the government gave to care homes. Negative tests are not required prior to transfers, admissions into the care home. By mid-April, there'd been a change of policy. The guidelines then said, we can now confirm we'll move to institute a policy of testing all residents prior to admission to care homes. This will begin with all those being discharged from hospital. But by then, some care homes say the damage was done. Keith Gray represents 250 care homes in the northeast of England.
I believe it was one of the major factors that caused the outbreaks in the care homes. We could probably never prove this, but we believe it was one of the major factors.
Do you think that policy cost the lives of the elderly in some care homes in this country?
I believe it probably was a factor. We can't ever be for certain, but I believe it was a factor, yes.
Sky News has obtained these letters sent by a number of local authorities exposing the pressure put on care homes to comply with the original COVID guidelines. Several councils said they would withhold so-called uplift payments, extra money to deal with the outbreak, unless the homes agreed to new terms, including taking in confirmed COVID patients. And it wasn't just councils pushing care homes to take COVID patients. Digby Manor in Birmingham prides itself on its stringent safety measures and its COVID-free status. Its owner says saying no meant going into battle with the NHS, a fight which he claims, in spite of the policy change, hasn't gone away.
There were raised voices, there was threatening, telling us we had to take these residents. I had a discussion with other providers, and I made it clear that we were not going to buckle under this. Our duty was to make sure we did not spread it in the home. Unfortunately, other providers unfortunately felt they had no choice but to.
The Department of Health and Social Care said it's untrue that government policy has allowed the spread of coronavirus in care homes, and that they've been working with the care sector to ensure they've had the best advice based on the latest scientific evidence. The Prime Minister has described the situation in care homes as an awful epidemic that has to be reversed. The strategy to protect the NHS has so far worked, but some care homes feel it was a policy which failed to shield their elderly residents. Lisa Holland, Sky News, Birmingham.